My name is Brenda Duckworth. I'm a registered nurse and the director of nurses, home health care.
How long have you been doing this work?
Almost 20 years with home health care. Yeah.
Okay, very good. So you're an expert.
Well, I've been around a while. So we're helping them with their medications, maybe IV administration, wound care, teaching, educating, that type of thing, helping them get over the hump. To keep them out of the hospital, that's our primary goal. When they come home, that's when we get them. And our job is to, within a period of time, get them educated on how to self-manage their disease, get well, like if they're taking antibiotics or whatever, know how to stay healthy, or to at least manage what they have. Well, from what I've gathered, the patients aren't getting what they need to be safe when they come home from the hospital. That's very important. If you discharge a patient home and they don't have the equipment they need at home, they're at great risk for falls, injuries. If someone falls, well, it's 911 back to the hospital if they have an injury. If they don't have an injury, then we have to go in and we're doing education on fall precautions, but we can see what they need. We need to order it, so then it's who we order it from and how long it takes to get there. So we have some patients that are multiple falls, so if they don't have the equipment they need to keep from falling, then it's just more cost to Medicare. So it's wiser to give them what they need to keep safe. Because, I mean, if they're admitted back to the hospital, maybe they've fractured a hip, we're talking about weeks. You know, they're going to be in the hospital for a week, then they're going to be in a rehab for 3 weeks, and then back home again, when then you start all over to get them back to where they were before. Well, for the primary ones like suction machines or oxygen or nebulizers, those are health risks, not just fall risks. Those are going to get the problem with not being able to breathe, you know, so back to the hospital again. And you don't want them to go home without that equipment there. So then they're going to have to stay in the hospital longer until it gets there. No, I haven't. Of course, I'm not on the DME side, but I'm in the home health side where we know when the equipment needs to be there. But no, they haven't been saying anything. They're not I haven't heard my patients tell me that they know about any of this. Oh, it's extremely difficult. You've got a lot of them that, they're not in the computer age, these older people. They're in the 80s. We're living over 80 now. So we have patients that are in their 80s. We even have some that are in their 90s. Can they, get on the phone and make multiple calls when they can hardly see, they can't hear that well? Maybe they don't have a caregiver that can help them out, or someone that's not there readily. So it's very difficult for them. Well, we have a lot of patients that are kind of fending on their own. I mean, they're independent. They don't want to be living with their family or whatever. They want their own place. But the family, it's hard on them. They have to go in and out, every day, check on mom, make sure she's okay, she hasn't fallen. And if they can't afford to hire someone to come in and help her on a daily basis, then she's on her own. There are programs for those who can't afford it, but there's a midsection of people that they can't afford it, but yet the government says they should be able to afford it. So they're left alone, on their own. I mean, it's hard. You're working a job, you're taking care of your own children, and now you've got mom to take care of. So they're overwhelmed. Their days are full. I wasn't aware until all of this began with the DME side of our company, and I'm like, really? 2 weeks to get what they need or whatever, So it was a shock, especially when our patients need it ASAP. I'm used to being able to call a DME and getting it out there that day. because they need it that day. If you wait a week, you might have a hip broken or whatever. When people need medical equipment, it's because they need it now. It's not because they would like to have it, it's because it's needed. So we can't have delays.